Hello Health on LAE is presented by the Ochsner Health System, a nonprofit, academic, multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 7 hospitals and more than 35 health centers located throughout Southeast Louisiana. Ochsner, healthcare with peace of mind.
Hi, I'm Jeff Fernandez of Humana, a proud supporter of WLAE-TV. At Humana, we want to remind you that it's annual open enrollment time for seniors, the time to make your selection for medical benefits. This enrollment period ends on December 31st, so you have only a short window in which to make your decision. Enrolling in a Medicare Advantage plan may be beneficial to you. In most cases, we offer additional benefits such as lower copays, annual preventative care, free gym memberships, and drug coverage at a lower out-of-pocket cost to you. We suggest seniors do the following 3 things to ensure they make the best decision. First, review what you've spent on medical services in 2009. Second, consider the network, benefits, and premiums of each plan to see which one provides the best value to you. And third, check with family and friends to see how satisfied they are with their plans. For more information, you can visit these 2 websites, www.medicare.gov or www.humana.com. Humana thanks you for your consideration and LAE for providing quality programming like Hello Health.
Good evening, I'm Tom Bagwell, and welcome to Hello Health, a partnership with LAE, the Ochsner Health System, and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight's topic, memory loss, and our guest is neurologist Georgia Lee. Well, Dr. Georgia Lee received her undergraduate degree from Kansas State University before moving to the Emory University School of Medicine in Atlanta. She did her internship at the Morehouse School of Medicine in Atlanta. She finished her residency in neurology at the University of North Carolina Hospitals in Chapel Hill. She completed her fellowship training with Dr. J. Araman Rao in the areas of Parkinson's disease and movement disorders. Dr. J. Rao has been a guest on this program. Dr. Georgia Lee joined the Ochsner team in August 2008 with her husband, and it is our pleasure to welcome her to Hello Health. Great to have you with us on the program.
Thank you.
Thank you for being here. Speaking of people who have appeared on this program, your newlywed husband, Dr. Stuart Busby, has been here to talk about sleep disorders. What was it that made you all decide, because you said you met at Emory, right?
That's right.
He was the resident, is that right?
Mm-hmm.
Okay. What made you decide to move to New Orleans?
Well, actually, I wanted to work with Dr. Rao, and so I called up, asked them if they had a job. They said yes, and when I said, well, I've got to bring a husband along too, they said, wonderful.
We'll work it out.
Yep.
Good. He seems very happy in his position here. Same with you?
Mm-hmm. Definitely.
Very good. Well, when most of us think of long-term memory loss, we think of Alzheimer's disease. What is Alzheimer's disease biologically, and can you show us what it looks like?
Well, there's a wonderful slide from the Alzheimer's organization website, and that's what you should be seeing on your screen now, I believe. On the left is a healthy brain. On the right is a shrunk Alzheimer's brain. And basically what we're seeing in Alzheimer's is a loss of those brain cells over time. You start off with billions, you still end up with billions, but you lose quite a bit. And in that process, you have problems with your memory, with thinking, speaking, walking, even personality.
So the brain is physically, the brain size is physically shrinking.
Mm-hmm.
Okay. And so it's not just what's going on. Is it what's going on inside the brain as well, the connections in the brain?
It's the cells actually dying. So you need all of those cells, all of those synapses to be who you are. And as you lose them, you lose that.
Memory loss doesn't necessarily mean Alzheimer's, does it?
No. Memory loss is just one part of our cognition, and cognition includes executive function, visual spatial function, and language.
When you say executive function, what do you mean?
I mean like balancing your checkbook. So in the slide you see those 4 functions that I just talked about in the blue circle. And then on the big white circle is dementia. In order to have dementia, you have to have the memory loss plus at least one of those other cognitive disorders. So that in itself answers your question. Memory loss does not always equal Alzheimer's dementia. But also in that big white circle, Alzheimer's is in there. It's up to 50 to 60% of all dementias. But there's also AIDS dementia, vascular dementia, Lewy body dementia, multiple other types.
Is it typically the short-term or the long-term memory that is affected?
It's typically the short term. As the disease progresses, long term is also involved, but initially it's going to be the short term.
Do we know what causes Alzheimer's?
No. If we did, we'd maybe not be sitting here having this discussion.
Perhaps at the end we can talk about some of the work, because obviously there's lots of research taking place in that area. To understand memory, we need to understand input. Talk to us about input and how it works.
So in order to get money in the bank, you have to actually input it, like in an ATM. So for memory, it's the same thing. In order to get it in, you have to get it in by hearing it, seeing it, feeling it, even smelling it. If there's something wrong with your input, then you're never going to get that memory stored.
The example that we talked about earlier was you're at a dinner party or any sort of party, and you introduce yourself, and the person introduces themselves, and then when it's 20 minutes later or even 5 minutes later, you're trying to remember the name of the person you just met. You heard it, but what you're saying is you really didn't hear it.
Right. And I think you said in one ear and out the other. That's exactly right. So maybe your hearing was intact. You heard them say their name, but you just weren't paying full attention to it, and it didn't stick.
We've heard about suggestions. If you want to remember someone's name, say it to yourself 3 or 4 times right after. Dr. Georgia Lee, Dr. Georgia Lee, Dr. Georgia Lee. Does that work?
Yeah, sure. Ask any 4th grader trying to remember their capitals. You have to repeat it, otherwise you won't get it.
We'll talk about memory and how it relates to learning throughout tonight's program. Well, that's it's supposed to work, where we hear it, get it, and it registers. What are some of the causes of poor input?
So some common causes, like for you and I, would just be distraction. I mean, like at this dinner party, somebody talking to us while I'm introducing myself to you. Maybe you heard me, but you were distracted. Inattention, your typical high school senior who is sitting on the couch and mom asks them to go, run an errand, and it never happens. Well, it's because they weren't paying attention. And sleepiness. If you're tired and you don't have the energy to hold a conversation or keep that information in your mind, you're not going to remember.
So give us parents some advice. And you're not there yet, you're a newlywed, but I yelled to my son, take out the garbage. And he says, okay. Did he hear it?
No.
Okay. He heard something, right? He knows I said something.
Yep.
And so he acknowledged the fact that I said something, right? But he didn't really hear it.
Right. And so maybe later when you ask him, hey, why didn't you take the garbage out, you're going to think he has memory problems. Well, not really. He just never got the input.
So how do I handle that? Here I am, the parent of 3 children asking the newlywed. Right?
I don't know. If you know the answer to that, I think you would be a millionaire.
I'm just throwing this out because we're just talking about, should I say, what did I just say? If I said, take out the garbage, and he says, got it, or okay, would it be fair for me, especially if I'm having issues, to say, what did I just ask you to do?
Yeah, definitely.
And if he says, take out the garbage, I heard you, then I know he's heard. At that point, do I know he has heard it and has it registered?
Yes. You know the input has happened.
Okay. After information gets inputted, it gets stored. That's the next step in the process. Walk us through the storage process so we understand that.
So there are many researchers around the world working on this, and I don't pretend to know the answer. But to simplify it, I kind of think about it as a bank again, putting money in the bank. Short-term or a working bank account, a piggy bank, and then long-term, like your savings and your bonds. So our working or our short-term memory is really just that. It's very short-term. You can quickly regurgitate information and get it out, but it might not stick forever. For example, a phone number. You know, somebody tells you a phone number, you remember it long enough to go write it down someplace, and then it's gone. That's short term. And we work with that all the time, constantly. And whether or not something goes from short term into long term depends on multiple other factors.
What are some of the reasons information may not stick in the short term?
Well, some reasons are just, like I said earlier, the inattention, distraction, but you can have problems with the processing of the cells. Simple vitamin deficiencies like B12, folate, thiamine can cause memory problems with the short term. Thiamine is a very famous one. Drugs or alcohol that's limiting how much you can stick. And then, of course, the dementias will affect the short-term memory first.
I've heard this from some folks that the minute you ask someone to remind you of something is the minute you're giving yourself permission to forget it. Have you heard that? And is there any? And it does seem to make some sense.
I don't know about that.
But you know what I'm saying? That
Yeah,
I've got
yeah.
a busy of something special that I've got to do tomorrow. So I say to my wife, honey, make sure you remind me to do this.
Yeah.
And what I'm doing is I'm giving it to somebody else rather than saying to myself, rather than putting in my storage, I'm essentially saying I'm stored enough.
Yeah, right.
Can you help me in this area?
Yeah.
It doesn't make any sense biologically?
I'm not sure that I can make the connection. For my husband and I, if he asks me to remind him about something, I tell him right there, oh, by the way, you have a meeting tomorrow. And he says, that's very helpful. Thank you very much. But
not what I had in mind, but it'll work.
Forget.
Right. Well, because you know he's heard it.
That's right.
At that point.
Yeah.
Does the importance of information have anything to do with how we remember it?
Definitely. So your son, who's not going to take out the garbage, it's not important to him.
Right.
If you
Important
said,
to Dad and Mom, but not to him.
Yes. If in the same breath you had said, you need to go find yourself a new car, I'm sure he would have heard it loud and clear and been out the door. So it's, importance has a big factor.
Great point. Does the personal interest level of what we're trying to remember affect memory? And this, I guess, has related to what you just said. But with adults who, if we have to go find a new car, we're usually not real excited about it. But if somebody for work we have to memorize something, or we have to remember it just because we need it, rather than a sports trivia fact for our favorite team that we think one day we'll be able to impress our friends with, or just be great to know. So does relevance have any impact?
Yeah, the personal interest and the relevance, like your son example, but also it's when it applies directly to you. So I give the example of when you're in the grocery store, and you hear those announcements, there's a spill on aisle 4. You hear it, it goes into short term, and if somebody asked you right then and there, what did they just say, you could probably tell them. But maybe 3 aisles down, you would have forgotten that there was this announcement about spill on aisle 4. However, if you were the cause of the spill on aisle 4, you're never going to forget it. In fact, you'll probably go home still telling the story that they announced it overhead and all this kind of
what
stuff.
aisle it was on, and what it was that spilled, and all those other things. Did Einstein really say that we only use 10% of our brain? and if he did, and regardless if he said it or not, is it true?
I'm not sure if he said it, but it is true. We don't use all of our brain. And one good example in regards to dementias and memory loss is those people who are constantly challenging themselves mentally, learning new languages, really stressing their brain.
Exercising the brain.
Yes, yeah. They tend to not progress as fast as others. So the person who's out there learning taking new classes is not going to, if they both get Alzheimer's, him and the couch potato, the one that's out there doing stuff, learning stuff, isn't going to progress as fast as the one that's sitting on the couch. And that's one theory, is that they're exercising more of their brain, and so they only have a little bit to lose.
Forget Alzheimer's for just a moment, but is someone's brain who is tested and exercised on a regular basis, is that person going to typically have better memory for having used the noggin rather than just letting it sit on the sideline?
That's a tough question, because everybody's memory kind of varies. You know, those annoying people that can remember every single thing that they've ever learned, and then there's me who has to read it multiple times. So it would be a hard comparison to make or to say about that.
Speaking of those people, are there people with photographic memories, or those supercharged memories? And do we know why they have, what is it about their brain that allows them to have that?
There are those people. I don't know if it's known why they are so smart.
You talked earlier about vitamins,
Mm-hmm.
and I don't know if supplements were in there or not, but in today's infomercial world,
Mm-hmm.
we see claims that this can do that, and certainly one of them is in the area of memory.
Mm-hmm.
To the best of your knowledge, do any of those, that you've obviously seen them,
Mm-hmm.
is there any proof that any of those work?
For your day-to-day working memory, no. If you are low on any of those vitamins, then very likely they're going to help out. But if you're normal, you're not going to notice any difference in how your brain works.
Okay. My favorite question to ask our physicians: do you take any vitamins or supplements for help in the area of memory?
No, I can't remember to.
Okay. Is the long-term storage process different than short-term memory, and if so, how? Can you talk about the differences?
So short-term, like we were saying, is very quick in, out. Long-term takes a little bit more effort. And if it's something that you're not interested in, then it might take a lot of effort. Mm-hmm. Up on the screen is the picture of a bank bond, because this is where, you know, your long-term storage, once you get it in there, it's going to take a lot to lose it. You can also put long-term storage memories by something very emotional. Like, we remember a lot from our childhood because of a lot of the emotional content in them. There's multiple routes to the long-term storage, though.
Okay. We've talked about inputting, we've talked about storage. Now it's time to talk about recalling information. What's happening in that process?
It's not just a simple reversal of our input, but you've got to get those memories that you've stored in there back out. And I think we've all had that experience of, you know, oh, what was that guy's name? And it's at the tip of your tongue feeling. That's retrieval. And it's normal on a day-to-day basis, but for some people it becomes almost their entire problem. They've got the memory, but they can't get them out.
And they're in there. When you're saying, I know that person's name, I know that person, it's not that you don't know it, you do know it.
Right.
You just can't get it out.
Exactly.
And do we know why that is the case?
No.
Most of us forget things from time to time, and you just talked about that. When is it time to worry about memory loss?
So if you notice a difference in your memory, then it's time to at least talk with your primary care doctor about whether or not something really is going on. But outside of that, everybody has these moments of, oh, I left my car keys here, or can't find this or that. That's normal. If it's happening so much that, you know, you can't go to work because you can't find your keys, then you might also need to consider talking to your primary care doctor.
In the promo piece we did for this program, we talked about if you can't remember that John Gilliam scored the Saints' first touchdown, no big deal, but if you can't remember your spouse's name or where you live, that could be a sign of real trouble. Is it what you're forgetting, not just how often you're forgetting, that is a sign as well?
A little
or sign of
bit.
Danger?
Yeah. If I understand your question right, it is a little bit about what you're forgetting, because, you know, if these are things that aren't important to you, you've got a full-time job and you're also taking care of 3 kids, and you've got a lot of things on your mind, and no, you can't remember where you place the car keys every other day. That's not a big deal. But if you're forgetting, you know, the soccer practice that you've been told about 4 times already this week, or something big, then yeah, it can matter.
Is it possible that someone has memory loss issues and doesn't even realize it?
Yeah, that's actually one of the saddest examples of what Alzheimer's dementia can do, because a lot of these patients don't realize. They think they're functioning normally when all of their family members and friends are noticing kind of weird, quirky things. So yeah, a lot of them don't.
Ochsner operates a memory clinic. Tell us about what it offers and when does it make sense to consider that as an option?
Yeah, so actually there are 2 memory disorders specialists at Ochsner. They work out of Baptist, and they are there on Tuesdays. That's Dr. Foundis and Dr. Catherine Smith. They also have a nurse practitioner, Lynn Eckhart. And basically that team, all they do is see memory problems. So a very good team. If you're at all concerned about memory loss, you really should see your primary care doctor first, because there are some simple things to check before you go to a specialist.
Okay. How is it treated at the clinic today, memory loss and dementia?
So we still only have a few drugs, and those drugs are only, they slow down the process for about 6 months. That's what they do. We don't have any magical cures, and really the treatments are limited.
Are there any non-medical treatments available to patients with memory loss?
Yeah, and actually these are what turns out to be most important, is the social services, getting care for the caregivers, and also future planning. So as you or your loved one loses their memory and their ability to take care of themselves, you need to know what's the next step. Where would they like to be? Where would they like to live? And all of those future planning issues need to be made while they are still cognizant.
And those aren't really treatment, non-medical treatments. Those are just getting ready for what's coming.
Yep.
Well, what should families of a patient with memory loss or dementia know? And there are some support groups, such as the ones you just described.
So first of all, they should know about support groups. Caregiving for somebody with dementia is, I've been told, has been the hardest job in the world, next to taking care of maybe a 2-year-old. So they should really take care of themselves, and going to a support group is high on the list. Any books that they can read about dementia and what to expect is also important, because knowing what's coming is really half the battle.
Talk to us about how, we have about 1 minute left. Talk to us about how long it will take from someone developing Alzheimer's and someone forgetting names, maybe forgetting where they live, to not being able to remember anything.
So it's about 10 years. Some are much faster and some are much slower, but roughly 10.
And do we know why it develops quicker in some patients? Does it go back to what we discussed earlier, that a sharper brain, or one that has been more thoroughly exercised, that process may take longer in that patient, that kind of patient?
That's some of the thought. Also, there are people that progress much faster, and it's just thought to be a more aggressive variant.
Okay. And how much does heredity play? How big is heredity a factor in this?
For most of us, it's not a big factor. There's research now on genes that might predispose us to Alzheimer's disease. But right now, it's not worth anybody's time to go get themselves checked for that gene. It's just not a close enough association.
Well, I want to thank tonight's guest, Dr. Georgia Lee, first for moving to New Orleans with her husband, another physician, Dr. Stuart Busby, and for the information and education she has provided us tonight, and for her work in the Ochsner Medical System. Thank you so much for being here. You've been a terrific guest.
Thank you.
Thank you very much. Great advice. Well, now here's our calendar, a look at the December Hello Health calendar. On Tuesday, December 1st, cardiologist Sangeeta Shah will be at Ralph's on the Park for a dinner seminar that'll ask the question, were you born with a heart defect? The seminar is $15 and includes dinner at Ralph's on the Park. That's December 1st at 6 p.m. And again, Ralph's on the Park just across from City Park. On Thursday, December 10th, Dr. Mehul Sheth will be at the Brick Oven restaurant in Kenner to take you inside the numbers of blood pressure, blood sugar, and cholesterol testing. That's Thursday, December 10th at noon. That seminar does include lunch as well, and the cost is $15. And finally, on Monday, December 14th, Dr. Von Graham will be here with me on LAE to discuss the latest techniques in the area of cosmetic surgery, and we'll be looking at fillers. Is there really a fountain of youth? We'll find out, or do our best to anyway, on Monday, December 14th. That's at 8 o'clock in the evening with plastic surgeon Dr. Von Graham on Hello Health right here on LAE. To make an appointment with any Ochsner physician, including Dr. Georgia Lee, our guest tonight, or to register for any of Ochsner's Hello Health seminars that we just talked about, you can call Ochsner at 504-842-5669. That's a special number set up just for this program, and you can call right now. That's 504-842-5669. As a reminder, you can rewatch tonight's presentation or any of our Hello Health programs on our website at WLAE.com or on Ochsner's website at ochsner.org. Just type Hello Health in the search areas. Our thanks again to tonight's guest, Dr. Georgia Lee, to Ochsner and Humana for making this program possible. And our final thanks, as always, is to you for your support of this program, for your great questions, for Hello Health on our station, LAE, more than television.
Hello Health on LAE has been presented by the Ochsner Health System. 600 physicians in 80 medical specialties working with a team of more than 10,000 employees to provide nationally recognized health care across Southeast Louisiana. Ochsner, healthcare with peace of mind.
Hi, I'm Jeff Fernandez of Humana, a proud supporter of WLAE TV. At Humana, we want to remind you that it's annual open enrollment time for seniors, the time to make your selection for medical benefits. This enrollment period ends on December 31st, so you have only a short window in which to make your decision. Enrolling in a Medicare Advantage plan may be beneficial to you. In most cases, we offer additional benefits such as lower copays, annual preventative care, free gym memberships, and drug coverage at a lower out-of-pocket cost to you. We suggest seniors do the following 3 things to ensure they make the best decision. First, review what you've spent on medical services in 2009. Second, consider the network, benefits, and premiums of each plan to see which one provides the best value to you. And third, check with family and friends to see how satisfied they are with their plans. For more information, you can visit these 2 websites, www.medicare.gov or www.humana.com. Humana thanks you for your consideration and LAE for providing quality programming like Hello Health.